Hello, and welcome back to another episode of Minority Reportz podcast and digital series. I am your host, Mona Shaikh. Happy weekend, you guys. Happy weekend. And I think this weekend is going to be a pretty cool weekend because Biden is going to be probably announced as the new president. And I am pretty freaking psyched about it. However, today I have a very wonderful guest. I have worked with him. I got to know him in New York City. He is a professor of pathology, very, very accomplished doctor. And I thought it would be a good idea because yesterday I brought on an EMDR therapist because I thought it would be something of help to my watchers and to my viewers. I think in the time of stress and everything that we're going through, I thought it would be pretty helpful to get some kind of inside information. And honestly, I really, really found it very informational and it was super, super helpful. But today I wanted to bring on another doctor. Apparently I know a lot of doctors and therapists. So that's my jam, apparently. But I have worked with this wonderful. I've gotten to know him, and he's just really one of the cool ones, man. He really is. Let me just read off some of the accomplishments of this incredible guest that I have today. He completed cytogenetics and molecular fellowships from Harvard University and Boston University. He's also a dual board certified by the American Board of Medical Genetics in clinical molecular genetics and clinical cytogenetic. And he is a CLIA CAP in New York State certified lab director. And one of the absolute key things that he does, and it really impresses me and touches my heart, is that he started a free of cost genetic diagnostic laboratory for childhood leukemia at the National Institute of Child Health in Karachi, Pakistan, which is my home city. And he's also worked, with the World Health Organization. And I'm going to let him come on and talk some more. So here's my very wonderful guest, Dr. Naeem. How are you?
Good, thank you. I didn't know I'm such an accomplished guy. Thanks so much.
We should read your LinkedIn profile a little often. How are you?
Good. I was trying to log in through my computer, but was unsuccessful.
Oh no!
I've been, old geek.
I'm sorry.
New things, but anyway, good
I'm
to
sorry.
see you.
Nice to see you too. Are you comfortable in the position you're in, or do you need to move stuff around?
Yes, I'm fine.
Okay, because this is going to go on for a little bit, so I don't know how tired you're going to get holding the phone, or you're going to put it down.
I'm just trying to see how can I connect my Bluetooth so I don't have to, just 1 minute.
Okay, yeah, absolutely. Please take it up. Here, I'll remove you from the stream. Why don't you get connected? Look at this. I try to be as professional as I can for you guys. Do you see this? This is courtesy of my super fan, James Hurley, who is here, who has been here since the beginning of me starting my live stream. So this is thanks to James, who was kind enough to send it as a gift to me. But I'm very excited about this guest because, by the way, I want to do this thing. I want to ask you guys, if you guys have any questions, because we're going to discuss about COVID and about the myths and all the kind of nonsense that's out there in the world about. I got into an argument with someone. They were telling me that COVID is just like the flu, and the flu kills more people every year than COVID. And then I had to pull up some facts on them and say, no, it is not like the flu. Maybe it has similar flu symptoms, but it is definitely not like the flu. And I felt that it was good to bring on a doctor, an actual doctor, who is highly accomplished, because God knows I'm a college dropout. So we'll talk to an overachiever. So here we go. Hi,
so I'm in. Yes.
Okay, awesome. Well, so Dr. Naeem, I just wanted to say that I'm a college dropout, so I am not even quarter smart and accomplished as you are. So I am like literally relying on all your knowledge and intelligence today.
But no. Then you have a wrong guy. But anyway, we'll try.
Oh no, we're in trouble, Dr. Naeem. What are we gonna do? And I wanted to actually ask you. So you're a professor of pathology. So have you been involved about COVID and everything that's happening with COVID, or is that not part of your world?
Yes, yes, definitely. We do the testing in our hospital lab, and I'm part of it.
Yeah.
I do one of my specialty is molecular virology also, which deals with testing for COVID. I've
Okay.
done many seminars and informational events with
Yeah.
community in US and in Pakistan. So I know a little bit.
You know, just a little bit,
Yeah.
just a tad bit. What are as a doctor, you watch the current sitting president, you listen to the stuff that's coming out of his mouth.
Now
I
you're going to
know
get
you
me.
don't listen to him. I know you definitely don't listen to him. But sadly, we have to, hear the stuff that comes out of his mouth, which is like vomit most of the time. But when you listen to him, is it frustrating as a doctor to listen to hear the stuff that comes out of his mouth, where he's like, wear a mask, don't wear a mask, social distancing, but not really. Hey, I'm gonna do a super spreader event, but is it really super spreader? How frustrating is it as someone who belongs to the medical community for you to hear something like this?
Yeah, it's very frustrating, as a matter of fact. And uh, but the sad part is that all the doctor community, including people who are working with White House, including
Mhm.
most of our community knows that just by wearing masks, you can stop this spread tremendously. And that has been proven and proven and proven again. And
Mhm.
saying that mask is not important is just not the right thing to say.
Yeah, yeah,
And and you are surprised that so many of us
yeah.
community in general still listen to that type of language which says that
Mhm.
go out without mask and do things and stop. No one is saying that you should not do things. Of course you do things what you have to do, but at least wear a mask.
Right, right. And maintain social distancing. So one of the things that Trump keeps talking about is that in the beginning, first of all, he called Dr. Fauci, who is, I mean, my God, such a brilliant man, the most qualified infectious doctor in the country, in the world, I would say. Isn't it, Dr. Naeem? Is that safe to say?
Yeah, he has served with three different presidents
That's
and
right.
been head of allergy and immunology, which is part of this center for
Mhm.
many years.
Yeah,
And he's a fellow New Yorker, actually. He
yeah,
was born and raised in Brooklyn.
yeah.
So New York's are, so he is quite accomplished guy. Means there's
Right.
no doubt about it.
That's right. And so somebody like Trump, who reads at third grade level and can't even form sentences, comes out and calls this accomplished doctor an idiot, and just really embarrassing. So he keeps going back to the point that in the beginning when COVID, everybody was just learning back in March when the pandemic was just hitting us, that Dr. Fauci said, "Hey, you don't necessarily need to wear the mask." Now, in his defense, doctors were learning stuff in real time, just as people were. So, I mean, how frustrating is that? That is the part that he's stuck on, and that's the part he keeps repeating to basically to his base.
Yeah, so initially, yes, there was CDC plus the team was not very what you call clear about wearing a mask, and one of the reason which I think maybe because that if immediately 300 plus million people want to wear a mask, where do you bring those masks from and what to do? It would have been real chaotic issue. So, and they didn't know about the disease that well at that time.
That's right.
So, with time, everything we learn and we move on. I think now there is no doubt in anyone's mind that mask should be wear or not wear.
Yeah. I mean, I don't know if you've seen any of the Daily Show, segments. There's a very brilliant comedian by the name of Jordan Klepper. He's one of the correspondents on the Daily Show, and he went to the one of the Trump rallies, and he's talking to one of the supporters, and he goes, I'm pro-life, and so Jordan Klepper goes, then why aren't you wearing a mask if you're pro-life? Right? Which is
Good point.
a very great observation. And
Good
he goes,
point.
well, I would totally wear it if everybody else was wearing it. And he goes, besides, I'm not sheeple. He goes, so you're not, he goes, but I will wear it if everybody else wearing. So wouldn't that also be considered being a sheeple? Right? Being a sheep. Right. So there's like this disconnect of intelligence and information where people are still going around. Like Trump had the super spreader event when he confirmed Amy Coney Barrett. People weren't wearing masks. Trump himself got diagnosed with COVID. My question actually was that when Trump got diagnosed with COVID, did you believe him, and do you think he actually got COVID?
I believe in science, I believe in doctors.
Mhm.
And if that accomplished doctors are saying that he has COVID, so he has COVID and his tests were positive. So, of course, he had
Yeah,
it. But COVID also can affect you in many different ways, from very severe symptoms to very mild symptom and no symptoms also. So
yeah,
he might be somewhere in the earlier part of the curve where disease is not that effective or is not that pathogenic. So,
yeah.
yes, but he did have COVID.
So could you tell us somewhat like the more mild to severe, because he got healed up pretty quickly. I mean, he was pretty ready to go in 2 weeks, which made me go, did he actually have COVID?
He did have COVID, and he had the best treatment possible in
That's
the
right.
face of the earth, and with cocktail of antibodies.
Remdesivir.
Yes, cocktail of antibodies and so on and so on. But so the thing about this disease is this: that
Mhm.
majority of them, maybe 80% plus, will have no symptom at all, but they can spread this virus for sure,
Oh.
right? Then out of that people who have some symptoms,
Mhm.
majority of them will have no serious symptoms. So it depends on your underlying conditions. If you are older population, if you are have some immunocompromised situation for transplants or cancer or so on and so on, or diabetes even, and cardiac issues and heart failure, and blood group also is also important. So people with A blood group affect much more. People with O blood group have less symptoms, type of thing, and your own genetic makeup is also important in that. So there are many factors, and but people who get sick get very very sick and they die. Means we have 300 plus thousand people died. I mean, that is not a joke. I mean, this is more than
Is it
uh,
300,000 already?
yes,
That's
right.
crazy.
No, I'm not sure about the number, to be honest, but we can check it. But there are big numbers are dying, and so for example, last 2 days we
Yeah,
have 100,000
that's right.
people infected, right?
That's right.
And even if you have a mild symptom, you feel very very bad with this. We have seen patients in our hospital which
Mhm.
were very sick and very in very much trouble. And think about this: that no loved one can even come close to you. I mean, this
Right,
is a
right,
dangerous disease.
right, right. Um, I have a question, but James here has a question. He says, question for Dr. Naeem. With COVID spikes occurring around the world, does he think it is simply due to people staying indoors more, or could it be COVID fatigue?
So uh, you mean second wave of COVID? Why it's happening? I think it is happening because it's this disease. Whenever you open up, when you let people mingle, when you people go into close restaurants and bars and even and parties, closed door parties, you do have even one person is infected that can infect 20 and 30 and 40, and they
Sure,
go out in their community. It's
sure,
like a domino effect.
sure.
So that is the reason for the second wave. And the scientists actually are expecting that. They were expecting multiple waves of this, people to control it, and then you get little liberal in your activities, and you get it again. And that's a sad part, but that's not unexpected.
Dr. Naeem, would you say that we are hitting our second wave right now?
Yes,
We
definitely.
are hitting our second wave.
We have we,
But you
we
just
have
said
the
something
highest number of COVID cases
in the world.
in the world, plus at any part, more than March and April. We have more cases now than March and April.
Wow. I mean, I mean, I think what was really alarming, what you just said, is multiple waves. I thought we were gonna be done by the second wave.
Right. So unless there's a vaccine out there which people start taking, then before that there will be multiple waves.
Definitely, they're talking about having a vaccination by the end of November. There is talks. I mean, Johnson and Johnson stopped their research because they said they were coming up with unexplained illnesses. They called it, and Trump was touting them around, and saying, "Oh, Johnson is doing a really good job with their research." But Johnson and Johnson came out and said, "Look, we have to stop our research because." We have in our clinical research, we're coming up with these unexplainable illnesses that we can't, so we have to stop. Do you think we're going to have a vaccination by the end of November?
So not by the end of November, but sooner or later, there are many companies working on vaccine,
Right.
and they are working very well. And I think the clinical trials are on the already happening. So we have to just wait for those clinical trials and make sure they are safe enough to be used, and what dose is appropriate for a person. All these
Yeah.
things will be decided by when this trials will be ending, and making sure that there is no side effects which
Right.
people may have. So it is coming, but it'll take a little time.
That's nice. What happens when the clinical trials happen? So clinical trials happen. They'll have a group of people of different ethnicities, different backgrounds, different ages and health. They do the clinical trials. So how long after the clinical trials do they wait to see the side effects of it, or are the side effects part of the clinical trial?
That's a very good question. Yes. So who was saying that you are college dropout? Somebody was saying that. I don't
I'm
know.
a college dropout.
So, so what clinical trial really, what it means, that they select certain group of people and number of people, and they do that. They set up a dose that they will give that much dose, and watch them with their blood test or clinical features or whatever it is. And once they do that, they collect that data and make sure they don't have any side effect. So and what dose is appropriate, for example. So these are volunteers who take this vaccine on a volunteer basis after signing a lot of disclaimers, I'm sure. And and if there is any reason they believe that it is not safe, they stop those trials. As you may have heard that a couple of trials being stopped and then restarted it, and they figure out why this side effect happened. And once they figure that out, they adjust that and move on. I think it's going pretty smoothly and pretty fast compared to many other trials or many other vaccines trials we have seen in past.
Right. So sorry. So they give the dosages, and then you said it's the side effects are part of the clinical trials, correct?
Yes, that's right.
Right. So they give it, and then they wait what, 1 week, 2 weeks,
So
month.
different vaccines have different time frames. Some wait for a month, 2 months, 3 months, and actually CDC, this FDA also want to, CDC and FDA, the authorities which approve these trials, they have to review data and wait certain period of time. There was a news item a few weeks ago that even the trials are done, they will review data and wait for some time to make sure there are no late side effects after the vaccination.
Is there a certain like month or time period where they're like,
You
this is
know,
safe? 6 months is
different vaccines have different time. Yeah,
got it.
different vaccines at different time, but minimum of 1 to 3 months at least.
Minimum 1 to 3 months, and so minimum 1 to 3 months to up to a year.
Right, it depends on different dose, different vaccines. Yes.
Right. Well, for something like this, Dr. Naeem, I think one of the largest, if not the largest pharmaceutical like vaccine maker is this Indian company. And the CEO was on MSNBC, and he was talking about how it's going to take about 3 to 4 years to come up with enough vaccines for everyone in the world.
You're right. So these vaccines are, manufacturing and distribution is a bigger challenge than making max vaccine itself. That is,
Right.
developing vaccine is a challenge, but
Right.
distribution to all the different population, and again, you have to decide that which patient group or population group you want to introduce this vaccination, and then slowly introduce to all of them. But it will be, think about it, that 3 billion people maybe in the world, or a little more, and
7 billion.
that much
7
vaccination.
billion. It's 7 billion.
7 billion, right?
It's a billion of us.
So,
It's a billion Muslims, but it's 7 billion total.
right.
You know, man, that is. I mean, but in the meantime, life has to go on. In the meantime, people will get infected. In the meantime, people will die. I mean, but sadly, if you live in a more poor nation, you are kind of last on the list to get the vaccine. I mean, what are we talking
Yeah,
about? You're talking about what? Like
that's
nations being wiped out? Like, what are we talking about here?
no. I don't think that. As I said, that only 2% of the patients die at the most, right?
Fun.
Yeah, very little, very small percentage, between
Wow.
1 and 2%. And now there are good treatment available also. So there's death rate in US has decreased a lot also. Hospitalization rate has decreased a lot also. But infection does happen, and many of us will have an infection, don't even know that we've been infected. So that's part of this disease.
Yeah. That's why I wanted to ask you, like, I know that in California, and I don't know, I think in New York, you guys have your gyms are open and your restaurants are open at, limited capacity. In California, Governor Newsom and Mayor Garcetti here had really just shut everything down. So we have no gyms open. Nothing is open, like nothing, right? You have restaurants, but it's outdoors. How, thinking about more on a building your immune system side, so many people have been suffering from depression, people have gained weight, including myself, drinking, smoking, all of that has went up, right? Because people are living in these uncertain times, they're trying to cope. People are but coping in a very unhealthy way. Some people have, of course, now we have more people in the neighborhood because LA is blessed with good weather around the year. People are out running and jogging, but gyms aren't open. How dangerous is it to open up gyms?
So I think any place where there is a poor ventilation, number one, and there's no social distancing, and covering mask is not there, is a dangerous place. And you may get infected, and if you're fortunate, you may not have symptom or have a mild symptom. But if you're one of the unfortunate one, you may end up in hospital. So it's the chance you're taking. But I would say in New York, things were very tight initially, and we controlled very well. And we are still in a good control mood. Whenever our governor or our mayor sees a spot or concentration of infection, they just block that area, and what you call targeted closure
Right.
rather than complete closure. So it all depends on numbers, what numbers you have and how things are moving. So it is controllable disease. If you look at Taiwan, if you look at some of the other, China even, they
Yeah.
have controlled it well.
Yeah.
You
Yes.
do more testing, you identify people who are infected and isolate them.
Yeah. A few months ago when Trump came out and said, we have more cases because we do more testing. And I'm like, that's that's kind of how that works. That's how kind of
Right?
now.
It's like if you do more pregnancy tests, you will have more babies.
Yeah, exactly. 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 It's like, listen, we have less smelly people because people are taking more showers. If they stop taking
Right?
more showers, I mean, come on. That's why. And
That doesn't make sense.
And you're just like,
That doesn't make sense.
that's ridiculous. Everybody should be getting. I've already gotten tested 3 times, right? Like, go to Dodger Stadium, make an appointment, go there, do a swab within 48 hours, within 24, 48 hours, they tell me my result, right? I mean, it's just about being preventative, being cautious. I wanted to ask you about, so I just think in terms of people not being able to keep up their health, not being able to go to the gym, not being able to take care of themselves. Like, you're also talking about immune systems going down, and not because people aren't working out on the same level, because they can't go to the gym. They're trying to work out at home, they're trying to get stuff, but not everybody has the finances, especially now that you have, my God, 11 million people don't have jobs. They don't even have the means to buy the equipment, to have it at home, to work out and take care of themselves. So if we have about 25% capacity where people go to the gym, social distancing, wear a mask, have good ventilation, that would be a lot better than no gym at all. Would you say that?
That is true, very true. And, I personally, I'm gaining weight also. I'm getting depressed also. I'm just tired of going to work and coming home and going to work. That's just not the good lifestyle. And now in Northeast with the cold weather, you can't even go out and walk and run that much as you used to. So it is the secondary effect of this COVID isolation is also very dangerous. Means, of course, economy is suffering. Of course, people are suffering. Of course, people are not going for regular appointment for 3 months. Do you think cancer stop working when COVID is here? You think the babies stop coming because of COVID? No. But these things do suffer, an unfortunate side effect. But if we use proper precautions, if we use proper social distancing, I think this spread can be controlled, and that's all we can do at present.
Right. We have a lot of gyms here that have started doing outdoor workouts, and I'm like, yeah, you can do an outdoor workout, and even though it's outdoors, and if you don't wear a mask and you're pretty close to each other, you can still catch it.
Yeah, again, there was a chart somewhere. I don't have it. I can send it to you, where it basically tells you that if you don't wear a mask, what percentage of a time you may get infected if other person is infected. If you are less than 6 feet away from each other, you have a higher chance of getting infection. And if you are 6 feet away and wear a mask, both parties, I think it's pretty rare, very low percentage, from 90% to 5%. Basically, the difference is. So it's make sure that your colleagues, your friends, and wherever you go, and sooner or later people have to do some social activity.
Sure.
But the only way you can do it is to wear mask and have social distance.
Dr. Naeem, what did you think of when Trump came out and at a press conference said, that you can take bleach and you can just infect your body with it and cleanse your system and get infrared light and just the way it hits the body, he said, the way it hits the body on the inside, that you can get rid of it. And I wanted to know, was drinking bleach part of his cocktail?
So that's a question we need to ask him. And I do not have that.
I would love that opportunity one day.
Yeah, privileged
did you
information.
Drink the bleach? Did you drink the bleach?
Privileged information, but he did get some antibody cocktail, which is pretty exotic and heavy dose, which treat this disease very well.
Yeah. I mean, you're talking about somebody who is getting socialized medicine, but he doesn't want Medicare for all. He doesn't want, he wants to eliminate Obamacare in the middle of a pandemic. But yeah, he's getting socialized, medicine. So he's fine. He's telling everybody else he's giving everybody else the middle finger, but he's just like, I'm going to be fine. You guys can die. It's fine. How is it that he's like 70 something years old? And
he's younger than Biden, by the way. Do you know that?
Huh? He's
younger than Biden. Yes.
Oh wow! By how many years?
Few days, I guess. But
listen, we had a choice between two old white guys. One who wants you to drink bleach, and the other one who wants you to eat ice cream. Take your pick. This is what we got. This is all we got. Uh, Kamala Harris is, of course, once they announce Joe Biden as the president this weekend, which is definitely going to happen, uh, Kamala Harris is next in line to, possibly to become the next president of the United States in 2024. Do you feel like Biden is talking about right now that he wants to reopen the economy, he wants to reopen the country, but with like federal mandated precaution?
Right.
What do you think those federal mandated precautions?
So everyone should be wearing masks in public
Mandatory.
places. Mandatory. Yes, mandatory.
Okay.
And social distancing.
Mandatory.
Mandatory.
So what happens during the holidays? Thanksgiving, Christmas? How do you sit around the
you
table?
have to do it differently. You just have to do differently. Means Thanksgiving in our family, we already celebrated. We said we'll do it outside. We family get together on one of the weekend October, and we were outside and grilled something, and that's our Thanksgiving. Means we're not celebrating on exact Thanksgiving date. It doesn't, you have to have precautions. Means not having precaution is really irresponsible, not only for you, but I would used to say that think about your loved ones, people you love, your parents, your uncles, and your aunts. So you may get an infection and have no symptoms, but you will bring that infection at home or a nursing home, and those people, those elderly, loving people, may die because of this.
That's nice. Do you work in a hospital? Do you have to get tested for COVID every week?
Not every week, but yes, often. I have 3-4 testing done already, and whenever you feel like, or you have an appointment, or you're meeting a patient, seeing a patient with COVID, you do get tested. Yes.
Wow. Have your hospitals been full?
So it was overfilled at one time, but
Okay.
now we are in control, and things are much better than ever. It used to be very, very bad. We used to have no beds available at all.
Wow.
I mean, we were having patients, and we stopped taking any patients for any other reason other than COVID.
Wow. Wow. When did that kind of started declining? And
So it was, the worst part was March and April. May, June, things started getting a little better, and now things are, much controlled, and
right.
pretty decent, I would say, in
Yeah.
New York.
Yeah, absolutely. I think Governor Cuomo has done a really good job.
Wonderful job, no
He's done a
doubt.
really
Yes,
good job.
yes.
Yeah, he's done a wonderful job. And
And that's what one of the trouble you have, that if Joe Biden has not announced publicly that he will have a female vice president, I think our Cuomo could have been a great vice president.
yeah. I mean, Governor Cuomo could have been but
Great vice president,
that's just
definitely.
another white dude, though, Dr. Naeem.
That's okay, but controlling COVID, I think he has proven
Yeah.
that he has done a very good job.
Yeah, absolutely. What do you think of the mayor of New York City? Do you think he has done a good job?
So he has done a good job for COVID, but
Mhm.
overall city is not doing that great. And there is some, what you call not a clear collegiality or friendly relationship between governor and
Interesting.
mayor. So this has been observed. And mayor says something, governor says no, and governor says something, mayor says no. But so they are a blurry of what you call roles and responsibility, and so. But overall, I think things are
Yeah.
doing great.
And see, that's the problem right there, right, Dr. Naeem? That's the problem.
Yes, that's a problem.
That's a problem
Absolutely.
because the top leadership sucks, so everything else is gonna suck.
Yes.
So you have somebody like Biden who comes in power and it's like, this is a federal mandate.
Yeah.
I don't care what the governor's saying. I don't care. You guys are all listening to the same thing. We're having a conversation. I mean, right now they're talking about what is it in Wisconsin? Cases are spiking through the roof.
Wisconsin, Michigan, Minnesota. These are worst places at this time.
I mean, it's a hub. When Herman Cain got diagnosed with COVID and had the super spreader event in Tulsa. And he was a big, when he was admitted, and then 2 days before he died, he tweeted, he's like, doing great, hanging out at the hospital, and then died 2 days later. And I was like, oh my God, that tweet did not age well at all.
Yeah,
Like at all.
this this thing is so unpredictable
Yeah.
that you get suddenly your whole body just shuts down because of virus load and clock coagulations in different parts of the body. So you don't take it easy. I mean, this is not. Whenever you have a symptom like that, just go check yourself in a hospital. We are treating it much better. We didn't know much initially, and that's why so many people die initially, because we didn't know what to do
That's
most
right.
of the time.
That's
Now we at least know what is the right treatment and what is the right protocol for different type of patients.
Sure. That's the thing, Dr. Fauci came out and said that, in his history of, in his career of, researching diseases and, curtailing them, he's like, he has never come across anything like, COVID-19. He's just never
Yes,
seen anything.
absolutely.
Oh,
This is a very difficult and different virus,
yeah,
and if people around the world have to be very careful. Means this is infecting. This is spreading of this is airborne, so that is a very dangerous situation,
sure.
no doubt.
I mean, everybody, there's this weird myth. There's a myth and these lies, of course, that came from Trump, that it is like flu. It is like the flu. Can you please elaborate on that?
Right. So it is a virus. So it's the same family as some of the flus are, but the way this virus affect and spread is much more than regular flu. So in regular flu, for example, flu A and B, the total death rate is less than 1%, means 0.5, 0.6% people there. Those are also very elderly, immunocompromised patients die. But in COVID, the death rate is much higher, double, maybe three times than the flu. Number two, the symptoms are very severe. Number three, the spread is very severe. And so, for a simple example, people have to realize that you may be normal looking and walking on the street, but you are still a spreader. You can spread this virus. You are just carrying this virus without symptom, and you can spread that virus. So that's the dangerous part. Flu, you have to have a flu to transfer flu to someone, and your flu symptoms are very obvious. Here,
Right.
the symptoms are not obvious, but you can still have a virus.
And the reason why some people would not be asymptomatic and like not show any symptoms is because their immune system's good, but they're still carrying it.
Absolutely. That's right.
Right.
So it all depends. If you're younger age group, healthy age group, you may not have symptoms, but you still have the virus and you can still spread it.
Sure. What fascinates me sometimes, Dr. Naeem, is that I know that the general consensus about COVID is that you have to have, you're elderly, you have underage, underlying health issues. I was at a dog park with my dog, and I started talking to this nurse that was there who works for Cedar Sinai. And I started talking to him, and he said, we've had 3 deaths thus far at Cedars due to COVID. And I said, were these people elderly? He goes, no, one was 18, one was 25, and the other one was 40, right? And I was like, but did these people have underlying health issues? He goes, they did not have underlying health issues. They were perfectly healthy and normal, got COVID, and died. So
So
what percentage
again,
of that is
right,
valid?
right. So again, as I said, that it depends on your genes, how you respond to this. It depends on your health and immunity and so on and so on. So yes, young people have died. Many young people have died. Many adults have died. Many. It's not all old people, but as I said, that no way of knowing that how this virus will affect you means it is just very unknown. And if you are one of the unfortunate one, you have a severe symptoms and may die. And if you are a lucky ones, you may not even feel any symptom and you pass it on to someone else. Or that is why once you diagnose, that's why testing is so important, that once you do the testing, at least you know who has the virus, and that person can be isolated or left away, kept away from the people who do not have virus, right? So that's why most of the scientists were keep saying and is still saying that do more testing, do more testing. So for example, college students, very important part is that if you identify someone as infected, you keep that student separate, and the rest of the people, 90% of the people, 80% of the people who do not have any infection, they can go live their life and do what they have to do if they're being tested regularly,
Sure, sure.
right?
Well, you said like regularly. What are you talking? Every week? Once a
So in White House, for example, they check patient people every day.
in
Test
where?
White House.
Really? Well, they have to, right? We've got to
But
keep the leaders alive.
it's still they got infected.
Still, they got infected. Right, right.
So there was a time they were saying there are more infected people in White House than in Taiwan.
That's that's right. I believe it. I mean, the fact that Trump was coming out and saying that now he said, "Oh, maybe I'm immune to it." It's like, dude, you don't have tiger blood. Like, relax. Maybe I'm immune to it, and it's like, well, you're immune to intelligence too. So there's also that immunity you built. I mean, I feel, Dr. Naim, how confident are you feeling about um, Joe Biden's plan to curtail this pandemic?
So I know that Obama and Biden people have a cookbook, as they say, or an action plan for how to deal with these type of virus. Remember, there was a virus scared for which was coming from Africa. What was the name of that virus? So they created a plan basically and developed an office, for example, to
Right.
control virus infections type of thing.
Yeah.
And unfortunately, this current administration, they demolished that department. They just fired everyone, and that cookbook, as Obama was saying, that maybe sitting somewhere's desk to balance the desk or something.
Yeah, I mean, it's just insane to me that a nation where we are the leaders of the free world, and we are the ones with the highest cases in the world. This conversation about herd immunity, right? Dr. Fauci clearly came out and said it's nonsense, it's ridiculous. There is no such thing as herd immunity. You're not going to let it just run through people. I don't know. Are you aware of? Are we doing something like that? Because I spoke to my Indian friends in India, and they're telling me that pretty much everything is open. Right? They're just like,
Yeah,
let it run through. They're like,
right.
let it run through.
Yeah, they are very,
Yeah, they're like, we have
whatever
enough
they
people.
did,
Let it run through. They're like,
but you know what I feel like, India and Pakistan and Bangladesh and South Asian and Vietnam and so on and so on. So when they develop, they grow, they have so much infection and viruses. And whenever you get a virus or infection, your body develop immunity against it. And then you have a less symptoms for that virus if you get it again. So I am sure that population is immune, somehow have a better immunity against viruses than the Western population, which has very limited exposure to disease and different infections and
why don't you
poverty.
say it, Dr. Naim? Why don't you just call us weaklings? Just say it.
Yeah,
Hey,
they,
we're a bunch of
they are
weaklings.
much protected, and so there is this
Bunch of
down.
wussies is what we are, Dr. Naim, is what we are. Bunch of wussies. I mean, I was thinking, like, you want to build your immune system, drink some tap water in Pakistan.
Right. Yes.
Build the hell out of your immune system. You're gonna lose a bunch of weight, probably about 15 to 20 pounds. You're gonna look fantastic.
Yeah.
You're gonna have a hell of an immune system after that.
If you survive. Yes.
If you survive, yeah, which is really survival of the fittest. That's Darwinist at its max.
Yes, I think that population has some type of immunity, really, because otherwise, or people die at home and they said this is just God uh, took them away and they have nothing to do with virus. He has died.
Is that what people are saying?
Yeah, yeah.
They just died because
So
God
think about
took
it.
their time.
What percentage of population has access to emergency rooms in India and Pakistan? Not much, really.
Maybe 5%.
5%, right? So what about rest of the 95%? What they do, they just think that this patient, this person has a fever or a cough or something, and suddenly passed away, and
Sure.
that happens. Yes,
Oh, they just had a bad cough and then they died. It
yeah,
was their time, and you're just
yeah.
like, oh my God, no, it's COVID. My mom is in Karachi right now, and I'm just terrified, absolutely petrified for her safety, and just really, really worried about her. And she's there right now, and there's really nothing we can do.
But one thing she can do is to have good mask and
Yes,
keep distance.
that's exactly what she's doing, and that's exactly what she's doing.
Right.
Recently we had a tragedy in the family. My cousin passed away in a car accident, and all the family got together, and I was like, oh my God, I know this is sad, but are you guys social distancing? Are you guys wearing face masks? Like, are you taking face masks to eat? So you're exposing yourself. Like, you know that in our funerals are also very big kind of
Mhm.
meet and greet. There's a lot of food that's being served, and people are eating and talking and hugging and kissing. And I'm just like, oh my God, this is. It almost feels like a super spreader event.
Absolutely,
You
absolutely,
know?
and there's so much tragedies because of COVID.
Yeah.
And I lost my aunt in Minneapolis in the
Mhm.
early stages of the disease, and no one can go there. Even his kids who were in California could not go to Minneapolis to say last. So this is a tragedy, tragedy, tragedy throughout, and we need to be very careful.
Yeah. Yeah.
All I can say, leave your cell phone at home, but don't leave your mask home.
Yeah.
Don't
Yeah.
leave home without mask.
That's
That
right.
should be the focus.
That's right. Dr. Naeem, would you say that for the next, I don't know, 3 to 5 years, is this going to be our for the rest of our lives that we have to worry
So,
about wearing
no,
masks and do?
I believe that once vaccination is in full fledged population,
Yeah.
it will be like a flu. It will be around. It's not going to go away, but it will be like a flu. But very few people, hopefully, will get it,
Uh,
and fewer than those may have any severe symptoms. So it's just controlling means that's there is no real treatment at present like HIV, but sooner or later there might be a treatment also. But
right. But unlike HIV, this is airborne. You just
this
breathe
is
it.
airborne. Yes.
Right. So
Yeah.
this is I mean, do you, I don't know, have scientists have enough research right now to learn that even if we come up with a vaccine and let's say everybody gets vaccinated, is it possible that this virus would metamorphosize and adjust itself and become even more vicious than what it is?
So it is happening in their virus. One of the definition of viruses, they divide so rapidly that they mutate. They change their forms and
Mutation.
shape. Yes, and there are at least few cases already identified who have mutated, who have a different virus than the rest of us. So, but
Right.
fortunately, they are not that severe.
Mhm.
And the severest one is which we initially started from Italy, I guess. And you know that the West Coast got virus from China, but the East Coast virus is actually from Italy and Western population. So it is
It's a
much more
different strain.
severe. It was much more severe
Yeah.
than the say what came from China.
So the virus strain,
Strain.
the
Yes.
strain in New York was a lot more vicious than the one we had in the West Coast.
Yes. Yes.
Interesting. I mean, Italy, like they wiped it. I
Yeah.
mean, they wiped it out. My ex is a German scientist, and I had him on as a guest early on when the pandemic hit. And because he's a research scientist, I wanted to ask him. And he resides in Germany. Resides in Cologne. And I was like, Germany just took really, really strict measures. And what Angela Merkel did, which was pretty brilliant, and she went on national television and she said, look, we have our neighboring country called Italy and Spain. They have so many dead bodies, they have to call in their military to restore the bodies, to take the bodies on their, military sites because they don't have enough space to hold these dead bodies. Do you guys want complete lockdown, right? Where we curtail the virus, everybody stays home, right? And hopefully the virus just drops on the ground and just dies, right? Then it doesn't have carriers. Or we do just a little bit of closing, right? We try to do so. And unanimously, the country said, shut that shit down, basically. They were like, shut it down. They were like, shut it down, right? Of course, then they had the protests in Berlin where you had your crazy folks, just like we have in America, protesting and saying, open up the country. And then everybody told them to shut up and sit down. And then, and one of the key things that he told me is that the people who have survived COVID now have memory loss, breathing problems, heart issues. I mean, if you're talking about a 70 to 80% survival rate, you're talking about permanent, lasting, lifelong health issues.
So yeah, so as we move on with the time, we will know real side effects of this COVID.
Right.
And some of them can be very severe. Of course, there can be a permanent damage. If your artery got blocked in a brain or in a vital organ somewhere, that part of the brain or that part of the vital organ will stop functioning because there was no blood supply towards that. So coagulation, microcoagulation is one of the very common symptom and disease mechanism or pathogenesis, and so that can happen. So we don't know what severe things can happen. So it is still unknown. Yes,
Mm-hmm.
and which can be a memory loss, which can be some thing not functioning in some part of the body, and who knows.
Right, right. Have you come across patients who are like, yeah, I have this health issue that I
So,
have?
fortunately, I do not work directly with patients. I work in a laboratory.
Yeah,
So, I just look at their blood samples and do the testing part.
yeah,
So, but yes, people have seen very severe symptoms and, of course, side effects also. This,
yeah.
this is all published and all available in literature, as a matter of fact.
Wow, wow. James here has a question. He says, before the pandemic, I read that herd immunity doesn't work until the group is 90 to 93% immune.
No, so the herd immunity is like 50%. If 50% plus people are infected, have infection, right? So if two people are walking on a street and one is infected, one is not infected, so they
Uh-huh.
both have equal chance of not giving an infection or giving an infection. So at certain time in a group of 10 people, you assume that 5 people are already infected. So that is what called herd immunity, because almost equal percent of people are infected and non-infected. So it doesn't increase the percentage over that. It will stay like that, and that's called herd immunity. And that herd immunity, in other words, is also vaccination. So if you make everyone who is positive for vaccination antibody, you will not get infection,
Wow, wow,
right?
right.
Right. So if out of 20 people, 10 people, for example, already have infection, so they already have antibodies, so they will not get infected because they are hurt. They already have. So it stays controlled. That's all it is. I mean, herd immunity is like vaccination, but it takes a lot of toll, lot of death, lot of symptoms, and lot of patient infected to reach that level. So in US, for example, it's not even 10% people who are infected, right? So look about from 10%, you moving it on to 50% or 60%. That's a lot of travel, a lot of real estate to cover to get people get symptoms and signs and death and so on and so on.
I mean, we are a population of what, 330 million?
Yeah, close to that.
Yep. So, and half of that, what are we talking? 165 or something like that? 165 million people
Yes.
infected? Woo!
No, that's not happening.
Oh, you don't want that. I mean, the cases, like right now that, we have what, 100,000 cases that we just got. I mean, was it just in the past 2 days, isn't it?
Yes, continuously last 2 3 days, it's close to 100,000 new cases.
What percentage of that you think is going to be, I guess, is going to result in death? Less than 2%, you said?
Less than 2%. Yes.
Wow, wow. But the rest may survive. Some may come out with permanent health damages.
So, as you may have seen that in last few days, there was a news that every day, like 1,000 people are dying,
That's right.
right? So, 1,000 people out of 100,000 is 10%. I guess. Oh, sorry, 1%.
Dr. How do you quantify the numbers in countries like India and Pakistan and even some African nations? I don't know how bad it is in the African nations.
So think about this: that you think the testing is less in United States, which we think will be. Scientists believe that there should be more testing. They
That's right.
should be testing maybe double or triple, maybe more, right?
That's,
So
that's
think
right.
about and here you're not paying for testing. It's covered by insurance or government is paying for that. But in India and Pakistan, Bangladesh and Vietnam and African countries where
Yeah.
there is no insurance
And even in South
issues,
America, even in South
and
America.
South America, of
Right.
course.
Sure.
So you pay out of your pocket. So if I have to
Oh,
pay, X number of dollars to get tested, do you think I will go and get tested? No.
no.
that's
Because the governments are not
that's why.
providing it.
Yes, government is not providing tests. That's right. So there are people who are infected walking around and nothing's happening, and that's unfortunate thing. But means they are surviving and they are still doing okay. That's all I
Yeah,
can say.
yeah. That's nice. You don't think that like countries like India and Pakistan and even South American and even African, you don't think that they have enough means to at least conduct these tests? I mean, the tests are cheap.
Yeah, it takes a lot of resources to develop this test and perform this test. It costs. And here we don't know about the cost because we don't pay for it.
Right.
But
We're,
I know in the
we're
lab,
privileged. We have
yeah, yeah,
privilege.
we are privileged, and
Yeah.
but I know that this test costs $50. $50 mean if you convert that into any currency, $50 to $100 means that's the average cost of per test, PCR based
Really?
test. Yes,
$50 to $100 per test.
yes.
I didn't even know that. Wow. Because the government picks up the tab. So how would I? I don't know. Wow. That's a lot of money. That's a lot of money, Dr. Naeem.
Yes.
Dr. Naeem, how much?
It's going down means there are newer technologies,
Sure.
pooling samples, and so on and so on. So
Yeah.
they are decreasing the cost, but initially that was at least $50, maybe more per test.
Wow. 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 Dr. Naeem, my concern is when the vaccine comes out is about the anti-vaxxers. There is this huge challenge that we're going to face with the anti-vaxxers who are already talking about, I'm not going to get vaccinated, my kid's not going to get vaccinated. And it's just like,
So, but the thing about this, that's good thing is if I get vaccinated, I
uh,
am prevented. The person who is not getting vaccinated, he will have infection and nothing we can do about it. So if
right,
it's about human choice, so be it. I'm fine with that. But I don't want to be
I'm fine
in
with you
in.
dying. It's fine.
I'm not
I'm
want to
good.
be. Yeah, I don't want to be irresponsible and number one hurt myself. Number two hurt my loved ones.
Sure. Absolutely. Dr. Naeem, do you think you can get reinfected if you've got
Yes, of course. So,
you can?
yes, yes. So think about this: that
Oh
if
my
you
goodness.
have a flu, for example,
It just
right?
keeps getting worse and worse. My God.
So if you have a flu, for example, and
Huh.
you take a flu vaccine,
Yeah.
so what
I
it
did.
doesn't, Right. So I do too, but that doesn't mean that I cannot get flu. I will get a flu, but I will not have symptom because my body is fighting well against that flu. And same thing about virus. I mean, if I have a virus and I develop immunity, that's what happens. If the average person, when they have COVID virus and they infected and recovered, that means they have immunity. Their cells have a memory of COVID virus. So if COVID virus reach their body again, body is already trained how to fight with that.
Because of the
So
antibody.
yes, because of the antibody, and body is immune to it and fight with it. But that doesn't mean that virus cannot enter your body. Virus will always enter your body, and you may reinfect someone else, for example.
Jesus.
But you immunity doesn't mean that you cannot get reinfected.
So Dr. Naeem, so let's say I get vaccinated, right? And then I get COVID, right? Or well, let's put it on somebody else. God forbid, I don't want to get COVID. But like, let's say somebody gets vaccinated, they
Let
get
it be me. That's okay.
no, not you, Dr. Naeem. Never, never. Please, we need you. You're an essential worker.
That's right.
I just tell jokes
But
on
I
stage.
didn't
Trust
I
me.
didn't get a chance to work from home or take a day off. We have been working every day since COVID started.
My goodness. Just on a side note, when the pandemic hit, they were listing these essential jobs and non-essential jobs. An essential job, the number one essential job was being a doctor. The number one non-essential job was being an artist. I was like, is this article written by a Pakistani parent? You gotta be kidding me right now. I was like, what is everybody doing sitting at home? What are they watching? They're watching artists on TV. Otherwise, they'll go crazy. So I was like, this is a thing, this is an article written by a Desi parent. I was like, it may very well be my own mother. She's like, let me tell you, you are not essential by any means. What you do is not essential.
Right.
No, but so
But,
if a person gets
but
vaccinated,
yes, go ahead.
they get vaccinated,
Mhm.
they get COVID, they get the virus, they're asymptomatic,
Mhm.
right? So they can still carry the virus and then just
Yes.
pass it on to someone.
Yes. Yes.
That's crazy.
Yeah. Yeah. So that's why social distancing and masks are so important.
So this is our
That's the only way you can prevent yourself and prevent others, or be cautious, be considerate about others.
so Dr. Naeem, we're talking about a future where we will never be able to get in a and go to a concert.
No, no, it will be fine. And once the large population will be immunized and have antibodies, so they are safe for having symptoms. But the only population which may have will be at high risk are a population which will not get vaccination or does not have immunity.
That's right. But you also just said that you can have immunity but still get the
But
virus.
you will not have
That's not.
symptoms.
But you won't have symptoms.
Yes.
And then whoever hasn't been vaccinated, they will get it and they will have symptoms. Interesting. Wow.
They may have symptoms, yes.
Huh? Yeah.
They may have symptoms.
They may have symptoms or may not, and they may just pass it on. When do you feel we would, in America and even around the world, can like kind of get back to our normal lives?
So I'm hoping by next summer things will be much better.
Really? Next
That is
summer,
true.
huh?
Yes.
Wow. I mean, I can tell you as a stand-up comic, like my life is just my entire like performance life is decimated. Like it's just gone. It's just stopped. We're doing online shows and it just is not the same, right?
Not the same at all.
It's never
Unless you see people's interaction and laughter.
even then, Dr. Naeem, even then, somebody's kid is crying, somebody is like choking their cat, and you're just like, Jesus Christ, like I can't focus. Like this isn't work. And by the way, and I do want to ask you this: are you are you also experiencing Zoom exhaustion?
Of course, Zoom is just, that is very true. The number of seminars I have to attend, and it's just so tiring.
Yeah.
Means,
Yeah, and it's not even like you can just zonk out. You have to be like on camera and listening. And, I did 8 Zoom calls today, 1 hour long each. My brain, after this, I think I have to take my brain out and put it on ice. Because it's like sizzling. I think there might be smoke coming out of my ears any minute now. Because my brain is like, and I am exhausted, like doing Zoom calls. I am burned out. Next name, like I know we're gonna start wrapping up pretty soon, but I wanted to ask you, as far as like these vaccines go, one of my biggest concerns also is that that pharma is not really very well regulated in America. I mean, the cost of medications is absolutely ridiculous. Ridiculous what these pharmas charge. My fear is that once the vaccines do come out, is it going to be $1,000 per vaccine, or you think the government's going to step in and regulate that?
So what I heard from our beloved president, that vaccination will be free.
Soon to be next. Somebody's getting fired, Dr. Naeem. Somebody's getting fired.
But he promised that vaccine will be free to every American.
It's going to be free to every American. I mean, okay, it's going to be free to every American. How much you think these vaccines are going to go, like, internationally? $20 a pop?
I don't know. Yeah, that no one knows. And
the pharma's going to make bank. Whoever reaches it first, they're going to make bank, right? AstraZeneca right now is also, I mean, all these major pharmas are like just out there, right?
Yeah, I mean, but they spend a lot of billions of dollars in developing vaccine also.
Sure.
So it's a free economy thing that you cannot, unless you have some profit visible, why would you spend money into it and develop something new?
But definitely, how is it that, let's say, a medication for diabetes, or that costs us $200 in America, same thing in Canada costs $50?
Yes, so that's the way you negotiate medicine and with the companies and what type of healthcare system you have. So even in America, same medicine, if you buy it through one insurance company to the other or through private, you get different prices. So it's so much, and that's why I loved Bernie Sanders. He was my favorite because one healthcare for all.
You're a Bernie bro, just like me, Dr. Naeem. See, this is why I like you, because we're both Bernie bros. Yeah.
So it means healthcare is a right. It's not
Medicare
a privilege.
for all, right?
Yes.
Medicare for all.
Yes.
Agreed.
So education and healthcare, I believe, is a human right.
Agreed.
And should be like that.
Agreed. James has another question. James is a very curious being.
He must be your secret fan.
Yes, there's no secret that about him. There's absolutely no secret here. The question is the length of immunity been determined yet, or is it the luck of the gene?
Right. So we have not seen the length, but so far, again, it's only like it started in March, for example. Real issues started in March, so it is only 6 months. So we will learn with time that how long this immunity can last. And especially with case of vaccination, we don't know. Some people are saying there's a 2-dose type of vaccine, so you may have to do it twice. So they are trying to measure now the percentage of antibody. A lot of literature is out there, but we don't know exactly how long the immunity can last.
Yep. Dr. Naeem, you witnessed this now. You have this wonderful, free of cost, is it a hospital or a clinic that you started in my beloved Karachi, for children with leukemia? What made you go, this is something that I want to focus on?
So, I'm from Karachi also, as you may know, and I had my education, which was free of cost, at no cost for medical school. This is amazing. And
where?
In Karachi. at
Really?
yes, and at Sindh Medical College or Jinnah Sindh Medical
How
University.
come, Dr. Naeem?
At that time, the cost was like not free. I would say $17, 17 rupees at that time per month.
This is in the 70s?
Yeah, 80s,
In the 80s?
right? Mid 80s. The
But now
cost was,
it's not like that.
and then also you get scholarship or fees waived, for example. So I don't remember paying anything for my medical education, but this hospital which is next to this medical school called National Institute of Child Health, NICH, and that's where the kids or poor or underprivileged kids go for treatment. And what we've seen, I was at that time working at Texas Children's Hospital or Cancer Center, and I know that kids with leukemia, it's a very tragic disease. Very little kids develop leukemias, and for some genetic issues, basically. So in West, the survival rate for that leukemia was 80%, 90% of the kids with that type of leukemia survive and do well. But in when I visited Pakistan at that time, they were saying that survival rate was not even 20% or 30%.
Oof.
So, and the reason was very simple that the treatment protocol for kids with leukemia depends on what genotype of genetic conditions you may have. And there was no testing facility who can do that. So we developed that testing facility with the help of Rotary Foundation at that time, and that saved, I would say, hundreds and hundreds of kids because now, before that, they were just treating everyone like a shotgun. So if you have a leukemia, boom, you take this medicine. If you survive, good. If you don't, you bad luck. And survival also depends on if your medication is working well, or if you overdo that medication, you will get killed. If you underdo that medication, you get recurrence. And both ways are, so that
Jeez.
lab was set up in 2007 and 8. It's
Yeah.
still running. Actually, we just working on it. We just formed a society which is called Pakistani Society of Medical Genetics,
Yeah.
and we are doing a seminar on December 6th, and introductory. We started doing some clinic also. That is due to Zoom. Now we are doing Zoom clinic at no cost to those
Amazing.
the kids
Oh,
at NICH. Every week, our colleagues, we have a group of 4 people at present, and the three of them do clinics, and they are doing this regular clinic at NICH via Zoom.
that's amazing, Dr. Naeem. I
So
mean,
there is some advantages of Zoom also, I would say.
sure. Listen. Also, the advantage of not getting COVID. So there's also that. The advantage of not getting sick. So there's also that advantage. I mean, you also worked briefly with the World Health Organization. You worked as a
Yeah,
consultant.
right. So I do go to different part of the country. Actually, at that time, I was invited in Saudi Arabia, which was a lot of genetic issues because of
Inbreeding.
cousin marriages and so on and so on. Right. So we
Sorry, I just had
that's
I
that
had a gag
happens.
reflex issue. Sorry.
That happens, and
First
yeah,
cousin, right, Dr. Naeem? First cousin.
yes,
But
yes.
that's interesting you brought that up because I was just going to ask you that about Pakistan also
But
about the
we're
genetic disorder.
not going another hour on this because that's a totally different
Oh no,
topic,
no,
right?
I'm going to bring you back on that one on the cousin hookup.
Right.
That's a whole different conversation. But I was going to ask you that this leukemia that you talked about in children, and that being a genetic disorder, I wanted to ask you, is that because of cousin marriages as well?
Yes. So no, leukemia is not because of cousin marriages, but a lot of metabolic disease, autosomal recessive disease, which diseases which runs in family,
Uh-huh.
of course, are because of cousin marriages. Definitely.
And the
Inbreeding. Like look at the Ashkenazi Jewish population. They have unfortunate, very high burden of many genetic diseases just because they are inbred for hundreds of years, and that happens. And same thing is happening in many part of Pakistan also, inbreeding, and that is not good for genetics or for that population.
That's right. That's right. I mean, yeah. I mean, there are more people than your first cousin. I mean, look around. I mean, you don't have to. Well, sorry to be crass. You don't have to bang your first cousin like there's other people. For God's sake, it's gross. It's really gross. Sorry. I know it's like a cultural thing for us, but I had this Pakistani couple that I've been friends with for a long time, and the wife kept having miscarriages. She had like 5 or 6 miscarriages. She just kept having miscarriages. And one day, accidentally, she finally got pregnant. She put on about 120 pounds during her pregnancy. I mean, she had to do a bed rest because otherwise she was going to lose the baby again. And accidentally, once the baby was born, she revealed that they were first cousins. And I was like, really? Really? I looked at the dude. I was like, dude, you're a good-looking guy, American born and raised. You couldn't find nobody else? Come on, man. Come on. I mean, good. How hot does your cousin have to be where you're like, you know what? I'll take the chance of inbreeding.
Yeah, that's hopefully with time things will change, or they have some type of screening done like we do it for Jewish population here. And so you get rid of at least known conditions which you may not be carrying or carrying.
Get rid of known conditions?
Yeah, I mean, so for example, cystic fibrosis, for example, Ashkenazi Jewish diseases. Now you can get tested for that before marriage and see if you are not carrying it, you're safe to get married.
What about second cousins and third cousins? Not
So
that I
it
haven't.
yeah.
But
No, I think you must be liking some of your second or third cousin. Looks
listen,
like.
I would rather put a bullet in my mouth. Thank you. So,
But it decreases by percentage. Yes, and I would say if I have my kids to get married someone totally different, Italian or French or nothing to do with India or Pakistan, because
we don't know.
that's what diversity is. Means.
That's right. Exactly. I mean, that's how we beat racism too, right, Dr. Naeem? That's how we beat racism. Everybody's gonna eventually just look beige, and that's gonna be amazing. Right. Dr. Naeem, this has been such a wonderful and such an informative conversation. You mentioned an event that's coming up on Zoom.
Yes.
In December.
So I will send you that information, please.
You can share it with us here too, and I can share it with our viewers.
Right. So I don't have a flyer ready, but it's a Zoom conference. Or if you want to know what are the current issues are for genetics in Karachi or in Pakistan, we have a group of people who are doing an informational session, basically that what we know about genetic conditions in Pakistan and what we want to do to help promote genetic awareness and basically, for example, that cousin marriages can be so bad also type of issues in that society.
Right, absolutely. James said, thanks so much, Mona and Dr. Naeem. A great and informative podcast. I am glad. Dr. Naeem, you are wonderful. And yes, please do send me the flyer. I'd love to share it with folks. I think Pakistanis and, and I think it's not even just a Pakistani, I think it's a Muslim thing where Muslims are just very big on
cousin marriages.
And we need to stop the banging up for first cousins. That needs to end. It just stop it. Stop it. There's multiple
or take precautions.
Or
don't want to be.
Muslims don't take precautions, Dr. Naeem. There's a billion of us. You think that we got there by taking precautions? We did not get there by taking precautions. We got there by not taking precautions.
I have to be careful what I say, but thank you so much.
Dr. Naeem, you're fantastic. I will talk to you.
Thank you
so much. Thank you.
Wonderful. Take care. Bye-bye.
Bye-bye. That was a lovely and amazing Dr. Naeem. He's just wonderful and so informative and so generous with his time and information. I know you guys enjoyed this conversation. I definitely did. You guys, I will see you on Monday. But have a lovely weekend. Have a great weekend because we're going to have a new president this weekend, you guys. We're going to have a new president. I am so very excited. Stay safe out there. Secret Service has already amped up security for President Joe Biden. I'm just going to call him President Joe Biden. I'm going to speak it into existence. because it's going to happen. But stay safe out there, you guys. I will see you on Monday. Have a nice weekend. See you later.